Good afternoon, everybody. Again, today is the Sedgwick County Daily Update, April 28th. Overall case count, United States. Yesterday was 972,969. Today's 994,625, a percentage change of plus 2.2%. In Kansas, yesterday there were 3,296, and today there's 3,491. A percentage change of 5.9%. And the deaths in Kansas as of today are 124. In Sedgwick County, yesterday we were at 339 positive cases, today 354. That was plus 4.4%. Our surrounding counties, Harvey 6, Butler 15, Cali 2, Sumner 3, and Reno 26. Again, back to Sedgwick County, 354 cases. Total recovered has been 174, and the total deaths remains at 6. Sedgwick County, the criteria for testing has been revised. Residents can now be tested if they have at least 2 symptoms instead of the 3 for the COVID-19. There are no restrictions on age or underlying condition. KDHE reports that as of noon today, more than 3,600 residents have been tested for COVID-19. The health department is currently taking samples of residents who meet the criteria to be tested for the disease at no cost to the residents. Health department took samples from more than 60 residents today from the drive-through site. It's stationed to be able to handle up to 100, and a report that we have 972 tests available as of today. We have capacity, obviously, to test more people than what we could do previously. You're encouraged still to call United Way of the Plains at 211 if you think you should be tested for COVID-19. They will interview and set you up an appointment. If you have general questions about COVID-19, you could still call 211. For updated information, you can call or visit our website at sedgwickcounty.org. Current orders in place. Again, the governor's order is the stay-at-home order is in place till midnight, May 3rd. At tomorrow's at the Board of County Commissioners meeting, the agenda topics will be an update of COVID-19 from Health Director Adrian Byrne, a discussion related to stay-at-home and public gathering orders, and consideration of the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security, the CARES Act that the county had applied for and was successful. So with that, I'd just like to close with, for some of you, when you were growing up in school, you were required to learn about the state motto, which was ad astra per aspera. I recall myself wondering, why would I need to learn that? But it translates to the stars through difficulty. And I would say we are right in the middle of getting to the stars, because the difficulty is in front of us. It's been around us, and we'll get through this. By chance?
Yeah. To ask a little bit about masks. I know the Medical Society had recommended universal mask wearing, and I was hoping you could speak a little bit about if that's something that's on the table for the county commissioners tomorrow, whether masks could be required or whether that would just be a strong recommendation.
You know, it's Chance. I got to defer to the majority of the commission. I think the commission is eager to hear what the governor's plan that she said she's going to roll out Thursday. If we have a chance to get an advance, not a copy, but maybe a summary, that would be helpful. But I'm not sure that we'll be able to have that in advance. So we will have some discussion tomorrow, and probably get a feeling from all the various commissioners how they feel. Strong recommendations for sure. I would say the 6 foot spacing that we're all familiar with, that seems to be just bona fide help for everything. So I'm probably the governor's order might have that in there too, but we'll see from there.
Hi, this is Deborah with KMUW. Can you tell us
Deborah.
how many contact tracers are with the health department currently, and how many will the department be hiring?
You know, Deborah, at one time I thought I heard 6 and maybe more, but I don't know for sure, Deborah. We'd have to get that information to you.
Chance again. Tomorrow's discussion, I know you mentioned the governor was planning on rolling something out on Thursday. So tomorrow's discussion will probably largely be centered on what the commission and our local health officials think is best practices going forward, or is it trying to kind of get out in front of Governor Kelly's stuff and have a plan in case she loosens restrictions beyond kind of what you guys want?
Well, I think that's part of that's for sure probably some of the discussion. We'll get everybody's thoughts. Adrienne Byrne will give hers. I believe Dr. Menz will be joining us. I believe. I'm not sure. Obviously, if we get something ahead of time, we'll be able to look at it in more detail. But until then, I don't anticipate the county taking any vote action on something since we really don't know what the governor's in the governor's plan.
Rachel from KSN, a question about the governor, the opening of businesses. Previously, I understand both you and Tom Stoltz had said hoping to give businesses 1 week's notice. So is it potential there could be less than that if the governor is planning to open things up later this week or announce opening up later this week? And also, are you guys going to plan to have a Friday special meeting to react to Thursdays, or are you going to, when is the next meeting you think going to happen after that?
Well, on the first question, I think there has been some discussion about do we give businesses time to organize, rehire, make sure clean, all those things, inventory. It looks like that it could be though as soon as Thursday, which is, as soon as Monday, which is not, which is only 5 days or 6 days from today. It depending on the governor's order on Thursday, it is likely that we will have a special meeting either Thursday afternoon or Friday morning. Because to either endorse her plan, I do understand that we, as the county or local governments, would be able to make it more strict, but they cannot make it less restrictive. And I think our Friday call with a lot of the businesses helped us get it was very helpful to know that businesses have not been sitting idle. They've been working really hard, especially the restaurant industry and I think the retail industry. And we get a lot of calls, and I know the hair industry and some others that are one-on-one. They're all working on their own plans that are kind of industry related. We're not the first area that's coming out of this, and so their respective industries. I believe they're calling around, especially Oklahoma, Missouri, Nebraska, trying to do best practices and leaning on their own associations if they were licensed, things like that.
Hey, Pete, it's Greg at Cake. We've heard repeatedly, testing is the key to knowing. Testing is the key to being able to tell when we can reopen. I know you've been talking about additional test kits that have been used so far. Are we at a point where you all are comfortable? I say you all within, the health sector at least, the conversations you all have had. Are you comfortable where testing is now to reopen the county if the governor says you can?
Well, the testing has been, as I said earlier, we have 972 available today. We feel confident that we can handle 100 a day. Right now, you're still tested if you have symptoms. So we really haven't gone to random testing other than I think some doctor offices are doing some testing on their own randomly if they wanted to. So I'm not sure that when we say test kits shortage, we'll take everything we can, so then we could go out and do some random sampling under the rules that CDC may have as far as population and zip code and all the cross sections. We're not there yet, but I know there's been some testing. You know, when you're testing a lot and there's only a few or come in positive, then it's helpful to feel confident that we can maybe do some more. Oh, I just got a note here. The health department has, Deborah, the health department has 14 contact tracers. 14. So on testing, we'd like to expand it. Our health department has said they'd love to do 1,000 a week. They've told us. I don't know if she'll say that again tomorrow. 1,000 a week would be, it'd take a year to do 50,000, which would be 10% of the population, which would be more than a sampling size. So I think if we can test a lot early, then it'll be helpful.
Eagle, do you know if any of the CARES Act funding can be used to help bolster our testing capacity?
Well, yeah, the CARES Act funding, it's pretty specific about coronavirus related items. And so test kits, I'm sure, could be part of it because we've ordered them. Test kits and support functions, if it's overtime, EMS, things like that.
There'll be more discussion
And
tomorrow.
as a matter of fact, and I'm told that it's on our agenda tomorrow to review that, and because our legal department is delved into the parameters around the money and how you can and what you can and can't spend. Plus, I think it would allow us to prepare over the course of time. It doesn't all have to be done during this quote pandemic season, whatever that is officially, but can be prepared as we go into the fall and into the end of the year. So it's not something that has to be done right away. So with that, everybody, thank you all for continuing to cover this, and it's really important that we get the facts out. So thank you. Be safe. Have a great day.